Speaking of America, do you have any friends who are in the health profession in other countries, Jeff?
Well, I wouldn't call them friends. I do have nurses from Europe and Canada who talk to me sometimes, who let me know, like they'll see a video where I talk about healthcare and they say, we totally agree. We love, especially the people from Canada. I've heard from the people who live there, everybody loves their health insurance that I've talked to. I've never been there. It's not like I have family up there, but in the rare occurrences I've spoken with people, they're very happy with what they have.
Yeah, as I keep hearing how Canada's great, then I hear people saying, well, they have these long wait times. You have to really wait when you want to see a doctor. I don't know if that's true or not. Do you have any indication?
For routine things, so let's say you needed a knee replacement. You were a football player when you were young. You're in your 40s now. You need a knee replacement because your knee was messed up really bad. In America, if you had great insurance and you had the right amount of money, you could go out right now and get that knee replaced. But in America, you could also be in like the 70% of the people in this country who need a knee replacement and can't afford to get it. So if you ask me, Tim, I would rather be on a waiting list than not be able to afford to get my surgery at all.
Yeah, that's sort of like a no-brainer. Yeah, that's the argument then. That's the argument. So when they make that argument, they're talking about people who have the actual disposable income. Then yeah, I guess I could just go jump in the car and go to the doctor because I got the money.
America's got the best health insurance and the best health care money can buy if you got the money to pay for it.
Wow. Yeah. Why do we pay? Speaking of money, man, why do we pay so much more for healthcare? I keep hearing that too. We pay more than most other developed countries, if not all Eastern countries. Do you know why?
I'm gonna name the enemy
Western,
again.
Western, yeah.
It's the insurance companies. It's the administration. It's the for-profit. I mean, their goal. I mean, think about it. They're a company, and they will openly tell you it is their goal to make profit. But they're making profit off of illness. You know, nobody wants people to be healthy in America. We want you to be sick, and then we just want to give you a pill every day to kind of take care of it. You know, we don't want you to get better completely. We want to care for you over time, and, you know, pardon the pun, but we just want to milk that tea. Every month, we want you to go to the store, buy more drugs, go home, take more pills.
Yeah. And sounds like a Chris Rock skit.
That's right, exactly.
You know, it was in my head ringing. I didn't want to give him a shout out because I can't get him to come on my show yet. But I was thinking what he said, just bandage it up, just to get you to the next stop, buddy, and so we can do it all over again, man.
Yeah.
God.
It's a crazy system where you have. I mean, let me look at it this way. Everybody wants to say, "Well, we're America. We're a capitalist country." You know, like it. If you don't want to go there, you don't want to pay that, go somewhere else. But I'm sorry, if I'm in the back of an ambulance having a heart attack, I'm not asking you for a price list of what open heart surgery costs for the 3 major hospitals in the area. You know, wait, no, I don't want to go here or here. Send me over there because it's the cheapest. And they're like, well, sir, that's 30 minutes away. You could die by then. It's like, well, you know what? I can't afford the other 2. So take me there anyway. Like, you don't get to make those choices. You know, if I want to buy a car, I can go to 17 different dealerships and barter and work for it. But when you need healthcare, you just go get healthcare.
Right.
You think about the cost later, but we can't even do that anymore.
Now maybe you shop around when you want, I don't know, a routine checkup or something. But if you have an illness, it's like the most accessible venue that you can get to is what you're going to use. I think most people.
Exactly. And you have no idea how expensive that venue is, what they're going to charge you. I mean, you have some hospitals charging you $100 for a Tylenol. When I worked in open heart surgery, just to be in an ICU bed cost you $3,500 a day. Just to be in an ICU bed. And that was like 12 years ago. It's got to be a lot worse now.
God, it's almost cheaper to die.
It is, especially if you get cremated.
Goodness gracious. You know, my mom is morbid like that. She always keeps telling me, Tim, when it's my time to go, just cremate me. I don't want anything fancy, you know, and all that. It's like, Mom, she's been telling me that since I was 10, though.
That's what my dad says to me, Tim. That's exactly what my dad says to me. I don't want nothing fancy. Don't spend your money on me.
You know, I don't know, man. It's, you know, I hate when she talks like that, but, man, this is horrible, what we're dealing with. What are some things look, man, you're blowing me away with some of this stuff, man. And it's hard hearing it. I know some people are listening, their mouths are hanging open, but we got to talk about it. We got to talk about what's going on.
People need to know what's going on. We're in the dark way too often.